What's going on, everyone? It's Jim here. I'm coming at you today with a super fun movement challenge to try. This one is great for deep gluteal fiber activation around the hip. That sounds fancy. Don't worry about that. It just means that it works to target some deep muscles around the hip. Now, before I dive into it, here's what the movement looks like. All right, so here's the movement. My right knee is down in this case. My back leg comes up. My front leg comes up. And now I'm just going to try and hold and support on this knee. Looks easy, but you might think differently when you give it a try. But keep watching because I'm going to talk more specifically about some neat things happening here, like proprioception and co-contraction around the hip. Really neat stuff, so keep on watching. All right, so now that you've seen the exercise, let's go ahead and break it down and let's look at what makes this such a beneficial movement to get really good at. The only thing that you're going to need for this exercise is just something comfortable that you can rest your knee on when you practice this movement. Now, I personally like to use something called an RX pad. This is just a foamy block that works really good for exercises like this and plenty of other exercises as well. But if you don't have an RX pad, that's not a problem. You can just either take something like a pillow, if you're okay with putting a pillow on the ground, that can work pretty good. Or you could even fold up a bath towel, make a nice padded surface for your knee that way. The softer the surface is, not only is it more comfortable for your knee, but it also makes the exercise more challenging because you now have a much more unstable surface that you're going to have to balance on. So that's a win-win. It's more comfortable for the knee, but you get a greater challenge. So the body and the hip are going to have to work a little bit harder in order to achieve the position that you're trying to stay in. All right, now with all that out of the way, let's break down why this movement is so great, the really cool things that happen with it, and what makes it a good challenge. Okay, now once you've found something comfortable to rest your knee on, whether it's an RX pad or a pillow or a towel, the next thing that you want to do is you want to make sure that you're positioned just by something that's nice and stable that you can reach out and give yourself a bit of stability or support for the movement. You're likely going to need that. Now, if my right knee is down, it's my right hip that's going to get the work when I attempt to do this movement or this exercise or whatever we're going to call it. And all I do is that back foot comes off the ground, and then the magic happens when the front foot comes up, and there it is. Now I got to try and hold that position. Now let's quickly talk about some really cool things that are happening here. The first thing you're going to notice is that you can't really produce the movement when your hip is back here. You have to really kind of push the hip through in order to be able to hold the position. And so we call this movement hip extension. And hip extension is largely produced by the big glute max muscle, the big rump muscle. So we're going to activate that and keep that active as we hold that position. Now another cool phenomenon that's happening here is something called co-contraction. And so for co-contraction, we're just referring to all the muscles in this case that cross the hip joint. They're all going to clamp down and activate at the same time to produce stability around the joint, especially with the kind of deep glute med and even deeper glute min muscles. We're really hammering those guys and asking them to do a lot. Now, if that doesn't happen, then again, I just fall apart and I can't really hold the position. And the next really cool thing that happens with this exercise is that we're enhancing something that we call proprioception of the hip. Proprioception is a fancy sounding word. All it refers to is the brain's ability to detect and determine a position that a joint or a body part is in space. Now, normally if I'm standing, for example, I get a lot of proprioceptive input through my ankle because my foot is in contact with the ground and gravity's pressing down, and so there's all sorts of proprioceptive input happening at the ankle. But when I take my foot off the ground here, I have to get more proprioceptive input through some of these gluteal muscles and hip muscles because I don't have any input coming from the ankle. And so when we enhance proprioceptive input, in this case into the hip, we're creating a better neurological connection for the brain to understand what's happening with the hip muscles. This in turn can help again with a lot of muscle health and overall health of the hip by having better proprioceptive input to this area of the body. So that's the movement there. You're going to try and hold for 5 seconds, try and hold for 10 when you can get that, and 15, 20, all the way up to 30. Now, if you can get more than 30, great, but you want to try and get for at least 30. And then once you get that side, you just try the same thing on the other side. And then again, you can reach out, stabilize as you need to. If you find the movement a little too difficult at first, all you have to do is keep that back foot on the ground and lift the front leg. Now you have almost like a little kickstand here, but again, you're still going to really feel that hip muscle or all the muscles of the hip have to work as you're trying to hold this position. So give it a shot. Great exercise to do. I think you're really going to like it. So give it a shot and let me know how it goes. So that's the movement. Very simple in concept, but very tricky to master. So if you're comfortable, give it a shot. Let me know how it's going for you, whether you find it super easy or super challenging. I would love to hear how it's going for you. Can you get up to 30 seconds? Can you get more? Let me know in the comment section below, or if you have other hip exercises and movements that you like to do, I want to hear all about them. Let me know in the comment section below, because I love to learn new things and I can learn great things from all of you out there. So that's it for the video. I hope you guys are all doing well. If you liked this video, if you got something out of it, please hit the like and subscribe button. That's going to help me grow the channel and keep getting more content out to all of you who are wanting to learn more about keeping your body healthy and moving well, staying out of pain, and the whole world of physical therapy in general. So hit the like and subscribe, send some love my way. That'd be greatly appreciated. Everyone, take good care of yourselves. I hope you're doing well, and I'll see you in the next video.